Welcome back to Voice Global. I'm your host, Pete Erickson, and this is part of our chat series that we're having with leaders from brands across the globe and across industries. My next guest I'm excited to talk about. I actually got to meet him for the first time a few years ago when we were just starting the Voice Conference series. And at the time, he was global head of innovation for Novartis. In fact, he was the global head of open innovation at Novartis Biome. And prior to that, he was with Biogen and Digitas and Chandler Chico companies. He has had a front row seat when it comes to innovation in the healthcare and life sciences space. And today we get to talk to him as the individual that has had this front row seat. He's not speaking on behalf of his current role as VP and head of global digital strategy at Bristol Myers Squibb. He's really talking to us as somebody who's had a front row seat on global health innovation. And we're certainly going to get into how conversation design is impacting this space. I'm excited to welcome our next guest up on stage here with me, Mr. Shwen Gwee. Shwen, welcome.
Thank you, Pete. It's great to be here. I can't believe how long it's been since we met in Newark for the very first Voice conference. And I'm honored to be here. Thanks for inviting me to be a guest again.
Yeah, it's fond memories of those early days. And it's hard to believe that actually it was only 3 years ago. It feels like it's been longer than that, just because I think how much has happened in our industry, how much it's evolved, and how people have moved around, yourself included. Taking on newer and broader roles and more responsibility. But we do sit here 3 years later, and we are in quite a different industry than we were back then. And I think that's really kind of my first question to you is, as an individual who's had, a front row seat on this industry, how have you, what's been your take on the evolution of voice and conversation design as it relates to health and wellness?
Sure. I think, overall, let's start with the whole digital acceleration that happened over the last few years, maybe as a broader scope to what your question's really driving at. I think when we went into the pandemic and really what COVID did, as a silver lining to the tragedy that it's been across the world, it's actually accelerated the adoption and the integration of digital into healthcare and especially in pharma as well. All the things that I think a lot of us have been pushing for before became the only way to do things in a world where suddenly we didn't have face-to-face opportunities anymore. So there had to be a lot more emphasis and a lot more priority given to doing things virtually, leveraging digital to do all the things that traditionally we could have done in a face-to-face environment. And therefore, the pandemic really drove this acceleration of digital adoption, integration, transformation, whatever you want to call it, across the entire healthcare industry. And that includes everything from adopting new ways of doing things, as well as the regulations, the different types of acceptance and adoption across the health industry. And that really just drove a tremendous amount of usage and integration of digital into every part of the healthcare system. So I think that was one thing that we really saw a huge jump on. Things like telemedicine went from, a very small, less than 10% usage to suddenly 80% adoption because there was no other way to do that. People were avoiding physical contact and going into a place physically, especially if they were already compromised as a patient. So that really happened. So then when it comes to something like voice, I think what you're starting to see is that's become part of the acceleration is how do we leverage something like voice and conversational AI to really start to engage our key customers, whether they're patients, caregivers, or healthcare professionals.
I think I can attest as a patient that the remote medicine was a fantastic, I think, acceleration that COVID brought on. I think a lot of folks would concur that being able to have that visit with their doctor and actually be able to have even maybe a little bit more time because the doctor was more freed up to see, to see folks and have conversations. And I did not feel like the quality of care went down at all. In fact, I almost feel like it went the other direction.
Yeah, absolutely. And I think that's something that really was allowed for the adoption of these types of platforms to be seen as more useful, provided greater access, was easier for the transaction to happen, and you could do it from your home.
Right.
So it just made it really convenient as part of your lifestyle, as part of your workflow, to really just integrate that. It was just a new way of doing things. And then especially when regulations allowed for reimbursement codes and so on for telemedicine visits, and then it became even more heavily adopted and integrated as to part of practice.
It's one of those things I hope really sticks around, after post COVID, and in many ways we're sort of getting there, right? In the United States, I think not every state or city is quite the same, but where we are here in Northern Virginia, things are starting to feel a lot back to normal. However, I think the way that we do a lot of things, the way that we access our healthcare, the way that hospitals are managing diagnostics and workflows internally has changed forever. And I think that's kind of like sets up three areas that I would love to chat with you about. One is kind of on a transactional basis. What are you seeing in healthcare? How people are, doing various things that you would need to do related to your healthcare. The other thing I would love to chat about is diagnostics and how voice and conversation design is starting to change some of that with what's possible. And I know that's a challenging road to go down. However, I think it's a really, really cool one. And then lastly is kind of workflows inside hospitals and how voice improves. So there's really kind of three different, when we talk about healthcare, it's such a broad thing, but maybe if we talk about those three things, let's take the first one, for example. What are you seeing with regards to how we access our care and manage it from an administrative standpoint?
Sure. I think the first use cases that we saw in healthcare were much more about the digitization of things that we traditionally do that wasn't on voice. Maybe it was through paper or online or by telephone, where it made sense and where the use case really fit, really applying it to those kinds of purposes. For example, for somebody who might be slightly they don't have access to, let's say, telephone, or maybe they have their dexterity is limited, could a voice channel or a voice skill, which allowed them to then access care management information, provide that level of engagement that was better than traditional ways of where you actually had to type something in and get it online or search for that information. Also, for example, for somebody who is looking to maybe find some information about reimbursement or copays for their medication, could that be done through a voice skill? So you're really taking the things that were done in a more traditional way and applying it to the voice sort of channel, and therefore thinking through that strategically to understand how it fits the patient's needs, and maybe very specific patients who leverage that channel more than others, and so being able to cater to that group as a result of that. So you're seeing that digitization effort of leveraging voice for those types of purposes.
Well, I'll tell you what, I did have a hospital stay during COVID, and I had a couple different surgeries, and so in dealing with all the various bills from the various providers that I touched during that time, I would love to be able to talk with an assistant device to help me navigate that. It's a daunting challenge, even for somebody who's fairly technically savvy. But I think there's a lot of opportunity there to really improve that. Let's talk a little bit about diagnostics, which I think is fascinating. There's a lot,
super exciting,
lot happening here. So I'm just going to let you take that.
Sure. I think on the front end, you're starting to see some of these companies, these startups, whether they're still startups now or whether they're much bigger than that because of funding is a good question. But some of them are starting to come into this space to really play that role of being more of a triage, right? Where you're asking questions based, and they'll ask you about your symptoms, and they'll start to narrow it down and provide a recommendation for what type of condition you might have. And so you've got a little bit of that front end triage before seeing the actual healthcare professional or specialist. You go through that kind of process. Examples of that are like a Babylon Health, where they've actually become really popular globally, but especially in the UK, where the NHS has adopted them as part of the triage process. And then on the other end, when it comes to diagnostics, you're starting to see some companies, some startups really work on that audio channel, the sample you get from somebody's voice, to be a way of detecting and diagnosing a condition or a disease. So really much more of what we call a digital biomarker, where we're able to take a voice sample, analyze it, and then from there detect if maybe you might have signs of depression or anxiety or MS for that matter. So it's really exciting to see how this field is really changing and leveraging these types of channels to provide new kinds of data that can be analyzed through AI and machine learning to really start to provide that information and insight to predict what you might have. And this is just based on massive amounts of data and voice samples that were collected. And then if you think about that, some consumer tools now are starting to also collect voice data. As you know, your Apple Watch can hear what you're saying if you go, "Hey Siri," and I shouldn't say that too loudly, otherwise my watch will activate. It picks up on that. You're also seeing something like Amazon Halo actually pick up and is able to record your voice, and it's starting to be able to provide information about your mood or your overall condition that day as a result of that. But that's where it's getting really exciting. As you think about all the voice channels when we talk on the phone or we record a Snapchat or TikTok recording or post. And what if that data could be analyzed and it could pick up nuances that allowed for that digital biomarker to be detected, and then realize that before you even knew it, you had a specific condition that you should probably go get checked out.
Well, I think that's something that a lot of folks might have some initial like trepidation about, but really, I think one day it's going to be commonplace that, our whatever device will be able to tell us that we're getting a cold. Say, hey, you've got a cold coming on. Let's do these things to mitigate it. Or it sounds like you've got the flu. Or there was a case where Fitbit. Somebody was sharing Fitbit data with their doctor, and their doctor got a hold of them and said, "You're having a heart attack."
Right.
And it saved that person's life. Now, had that data not been made available, and that diagnostic intervention would not have been able to take place. And I think this was, I think this was 4 or 5 years ago or so. But imagine being able to just have better care by virtue of all of the devices that are around us. I certainly would love that.
Yeah, I think some of this research and these types of solutions have been around for quite a while now. But the fact that the ubiquity of these devices are now so prolific is what's really giving much more access and ability to do these kinds of things. So everybody has an Alexa device or a Siri device or a Google Home device at home, and or in their pocket or on their hand, on their wrist. And so it gives a lot more ubiquity and ability for us to detect as part of your just everyday lifestyle, and not necessarily have to have a specific device that's sent to you in order to do it.
Yes. Yeah, I mean, I think that's one of the great benefits, and that will be a nice evolution of this kind of technology. And like I said, I think one day we will just expect that. That'll be something that is part of our care, kind of the part of the care cycle that we accept. And the privacy issues, if you go all the way back to the telephone, and then the television, and then the radio. I mean, these are all things that people overcame, and certainly with the internet. I mean, we've come so far, and I think that this next evolution is going to be quite exciting. Let's talk a little bit about inside the care facility and workflows and what you're seeing there.
Sure, I think there's several examples there. On the one hand, there are cases where you're starting to see some examples in the labs, for example, as scientists are doing research and their hands are full because they're filling beakers or they're doing some kind of procedure, and they really need some information either from a scientific calculation perspective or some knowledge from a database that they can't get immediate access to. Can they use voice as a way to get that information without disrupting what they're doing while in the experiment, right? On the other hand, you're starting to see, I think, healthcare professionals use it for the same type of reasons as part of their procedures or surgeries. They may need some information or some calculations quickly. They can leverage it for that. And then you're also starting to see examples which I think crosses over a little bit to that first example about more of the consumer space, but certainly is something that has been around as a test and experiment for a while, is where something like a clinical trial, we often collect what's called patient-reported outcomes. And there are some examples where they've leveraged voice as a way to collect patient-reported outcomes. And that's particularly interesting when it comes to patients that may have limited dexterity, like let's say they have arthritis, and writing it or typing it on a phone, their daily reported outcomes might be very challenging for them. So could you use voice for that reason? And I think that example was actually one of those that I sat in one of those sessions 3 years ago at the voice conference to listen to somebody that had to run that experiment and saw a lot of success in being able to do that.
All really exciting. I think that, yeah, it's funny, the doctor we had growing up, he would, and I'll always remember this, in the doctor's appointments, he would have his little micro recorders. Remember those little tiny, and they had little tiny cassettes like that big.
Yep.
But he recorded he was just, and chatting into the recorder everything that he was finding and his diagnostics, and then someone would listen to that later on and then fill out all the the necessary forms. But it was interesting to see that very early use of voice, and now here we are suddenly where not only is that happening, but then all of the probably recommendations and healthcare recommendations are coming back in real time.
And then, if you think about a doctor's workflow and how much time they spend on administrative work for each patient, could this be a way to really provide a level of ease and access and just make it much more efficient for them to work through a voice channel that's collecting it either throughout the visit or even after that, to be able to dictate and then collect, capture, and put it into the right types of fields within the database. It could be something that could really save a lot of time for them.
Save a lot of time, potentially save lives. I mean, if that data goes into a database and that's running on machine learning, where there's a broad access to a lot of diagnostic and care information that comes back to that doctor and says, hey, your patient may have this, because it's up to every individual doctor to be that source of information to try to make the best decision. And that's why we have to go get second and third opinions, because everybody may have a different experience with regards to what it is. So it's an exciting time, and voice is really at the forefront of all of this. And wrapping it up, let's talk a little bit about we kind of touched on this, I think, in every one of these, like what the future looks like, but what's exciting for you in terms of like what is the future? I think was it the X Prize had a tricorder type of X Prize available, but like for you as an individual, what's exciting for you to think about?
There are many things that are really exciting right now. I think there's certainly the application of AI and machine learning towards a lot of these types of channels and data is going to be huge for the industry, especially as you start to think about the amount of real world data that's produced by these types of channels and devices. As they collect passive data, as they collect data between hospital visits, as they start to collect data on a minute by minute basis versus a week by week or month by month or even year by year basis, we're getting much higher resolution. And then once you apply some of these algorithms in place to really start to pick things up sooner, detect trends, be able to predict things, I think that's really exciting to me as we move down that direction. And then also, like I said, the ubiquity of devices for voice or any kind of data collection, whether it's digital therapeutics, a voice channel, or something else, that's becoming something that allows us to collect enough data to analyze and then start to provide more information. I think what's going to be really interesting, though, is how the whole data and privacy regulations play out globally, because everybody's moving towards a much more restrictive and regulated world of data protection.
Right. There are a number of things happening simultaneously. Well, I think that, one of the promising things, though, is that at the end of the day, care is going to improve. Our access to care has improved through the pandemic. I think that's here to stay. Diagnostics are starting to happen. We had an app locally for the pandemic that we could download on our phones, and it would tell us if we actually came into contact with somebody that had COVID. Fortunately, I never got the alert, but it made me feel good that I actually had that running on my phone, and that it would let me know if that in fact was the case. But like that's a separate app, its own unique channel. But imagine in a future pandemic, there will be more in the future. We've had several in my lifetime. I would anticipate there's going to be a next COVID, but maybe the innovations that we've experienced and things like that app can all kind of like come together, where we won't need to download yet another app and have it installed. We will just know that maybe we came in contact with somebody that was positive.
Yeah, I totally agree with you. I think integration and interoperability is going to be key to the future. But more importantly, and especially for something like a channel like voice, I think what's really going to be a key and critical ingredient for us moving forward in this space is trust, and being able to both build and retain that trust with our stakeholders, right? Because as they start to hand over more data, which makes it more meaningful for us to be able to do things, we must ensure that that we're being trustworthy with that data, that we have a responsibility, and that they can trust us with providing that data. Otherwise, if nobody uses the app or nobody uses the channel, then you're not going to get that data anyway, and it's not going to be useful.
Trust is key. I think what's interesting is how many people trust their doctor, trust their family doctor. Mm-hmm. And I think that's a great place for this kind of care and this kind of access to care to start. And we know that just from the vaccine, how many people will listen to their family doctor before they listen to anybody else. And I'm excited for them, because we know how much pressure doctors are under. Doctors are under tremendous strain. The volume of patients they have to see on any given day is higher than ever. If we can make it easier for the doctors, they can improve their care. Trust goes up, and the future happens faster. So, well, Shwen, it's great to chat with you again. Thanks for joining us here at Voice Global. Your perspective on the healthcare industry is so important to us, and we hope that you'll come back this fall for Voice Summit. And I'll let a little hint in here. We are working on getting back together in person, so I hope that we can do that as well.
So I can hear your voice in real life. That would be great.
Yeah, no, it's time. It's time. I think that we're all feeling that way now. I mean, a year ago, we were just in the midst of like sinking into this and realizing the scope with which we were involved. Miracle of medicine is paying dividends with the vaccine. Also with just, people out there doing the right thing. Masking, social distancing to even help accelerate everything. But we will be getting back together soon. We're already doing that with our families, and some of us are back in the office, and it's feeling very good. I'm ready to get on an airplane. Anyway, well, we look forward to keeping this conversation going and watching this industry evolve, watching care improve, and watching the role that voice and conversational AI plays in all of it.
Absolutely, Pete. Thank you so much. It's been an honor and a pleasure. Thanks for having me on here.
Cheers.